First of all, I would like to talk about model of care. The Saudi model of care, which is a unique model of care, covers 6 domains. Under those 6 domains, we have the keep wellness. And this is one of the most important transformation in our healthcare services. In the health holding company and in the 20 cluster at the level of the kingdom, we have multi-level strategies and projects working on keeping our population well and in healthy style. One of them is the campaign which is done by the cluster at the level of the kingdom. The second one is the health coach, which is one mandate of our Saudi model of care at the level of the kingdom. The third one is what we have in Sahati application. Sahati application, we have a lot of education material for our customer. The other side is early screening of a lot of disease at the level of the kingdom. One of them is breast cancer, colon cancer, and also newly diagnosed diabetic patient. Those patients need to be diagnosed, and those patients will be followed up with a regular blood test. Another mandate in our Saudi model of care is to screen those high-risk group for osteoporosis. So all of those steps in multi-level services will lead to our population to be in a well and to be in healthy condition. I will mention 2 initiatives which was done in 2025. One of them is to fast in healthy style, and it was including 3 main arcs. The first one is 8 hours of sleeping. The second one was 8,000 of steps per day, and the third one was 8 tests for each customer. So we called it 888. It was under Ministry of Health in collaboration with the health holding company and all the region at the level of the kingdom. The 20 clusters did this one in the holy month of Ramadan. So we did around 40 billion steps during 1 month. In addition to that, we diagnosed a lot of newly diagnosed diabetic patients and newly diagnosed hypertensive patients. In addition to that, those patients who do have hypercholesterolemia, high level cholesterol or high lipid in their blood. Those patients, we detect them earlier and we put them in a track with the team-based care and family physician in our primary healthcare services. The second one was during Hajj, and it was just focused in the pilgrims from inside the kingdom. And in this initiatives, we targeted to screen all pilgrims going to perform Hajj, and we did for them some blood test, clinical checkup, and what we found some patients do have a high risk compared to other patients. So we have collected all of those high-risk patients based on the 20 clusters, and we sent them to Mecca cluster. And during Hajj, we did a follow-up for all pilgrims with high-risk disease, from chronic disease point of view or from newly diagnosed during our initiatives. This led to a best outcome for Hajj season, led to reduce their hospital visit, led to their need to emergency department visit, and lead to a healthy style for our pilgrims. It's just 2 initiatives from many initiatives at the level of the clusters led by the health holding company.